As COVID-19 rages on, communities of color are getting hit the hardest and dying at higher rates than white Americans. Although COVID is more deadly for older people and more white Americans are in this age bracket, the mortality rate for Black Americans is still 3.7 times as high as that of white Americans. Latinos, Pacific Islanders, and Indigenous Americans have also been hit disproportionately harder. Undocumented immigrants likely have been too, but it is unknown how many have COVID-19 because many fear getting tested due to fears of deportation. Experts point to structural inequities like living in areas with underfunded schools and barriers to higher education that often lead to lower paying jobs. Many of these jobs are deemed essential, so they're out in their communities in higher numbers and unable to stay home. People from racial and ethnic minority groups are also more likely to live in multi-generational housing, making the virus easier to spread. About 1 in 5 American adults under age 65 are at higher risk for severe illness from COVID-19 due to underlying health problems. Yet these underlying health issues are more common in communities of color. These groups are also less likely to have health insurance. Even for those that do have health care, lack of transportation, childcare, language differences, and discrimination in healthcare systems sometimes prevents them from seeking care. Some studies also show that discrimination and racism in daily life can lead to chronic and toxic stress that increases the vulnerability to infectious diseases like COVID-19. People of color also tend to live in more communities that are adjacent to plants and factories that emit air pollution, making them more susceptible to asthma and hypertension, which increases the risk of death from COVID-19.